And so welcome once again. This is your show, Líderes del Futuro, and I have Ms. Sylvia Lemus, who is, as always, here with us on KBBF 89.1 FM and kbbf.org. Every Thursday, or almost every Thursday, Ms. Lemus is here to talk to us about what's happening with COVID, the vaccines, Cura, and other services. So thank you once again for making the time and being with us. What can you tell us about COVID and the vaccines? I know that the vaccines in itself is one of the biggest questions people are having.
Yes, so the stay-at-home order has been lifted, so we're back into the purple tier from the plan, the blueprint for the protection of the economy in Sonoma County. So our numbers, we're going back to looking at our numbers, and right now our numbers are not looking great. You know, for per 100,000 residents, right now we have 34.3 new cases, which should be under 7 for us to be able to move to the next tier. And our positivity rate is 8.3%. It needs to be below 8%. And our equity measure metric is at 13.3%. And it also needs to be below 8% to be able to move to the next tier. So we are now the vaccines. So it's important that we also continue with our safety for COVID, but we are working on the vaccines. And just to let you know, we started a vaccination project. We were picked as a pilot project for vaccines here in Sonoma County. So we are targeting our most vulnerable populations, 75 or older, Latinx, elderly, disabled, houseless populations. And so we have a clinic that we set up through a state program, OptumServe, in Roanoke Park. So we did an invitation only to certain agencies that provide services to these vulnerable communities to invite their clients and patients to attend and receive a vaccine. So, and they can do 420 vaccines per day. So that's something that we started doing for our vulnerable populations. We are in phase 1A, which is our healthcare providers. Those are at most risk to exposure to COVID-19. But in the next 2 weeks, we hope to move into the phase 1B, which includes essential workers, teachers, food and agriculture workers. So we're hoping to get into that tier in the next 2 weeks, and also 65 and older also included in that tier as well. We're working on opening up vaccination sites throughout the county. Right now we have a Huerta gym that we're going to be opening, Petaluma JC, the Grace Pavilion, the fairgrounds, and we have some other sites like in West County and Sonoma Valley that we're working on as well. But we'll be having more and more information about a lot of these other clinics and sites that we have available for vaccines. But we do ask people to work with their providers, their health providers, whether they have a regular health insurance or a clinic that they go to check with them first to find out when it comes time for them to be able to receive their vaccine, how they can get their vaccine. But we also will have information on socoemergency.org/vaccine with a lot more information about who the contacts are at a lot of these different locations. And we will also be setting up sites to help to vaccinate more of the population.
Definitely. And again, it's essential for people to understand if you already have coverage such as Kaiser or Sutter, go and contact Kaiser and Sutter. If you go to your health clinic, then go to the health clinic or call them, that is, and just put yourself on that list so that people know that you're interested. Because we know that that's the other issue, that there's some people who are like, I'm not sure I'm ready to take the vaccine, this and that. You know, I was one of the privileged ones because we are passing masks out there to the community. I'm doing free DACA applications, which puts me at a higher risk. And I was privileged enough to be able to get the first vaccine. Again, the only side effect was a little bit of pain at where the needle went in. And I'm waiting for the second dose. I will be able to continue to do my volunteer work for my community, but I also need to make sure that I can be here long term. And the only way that I can do that, is if I can get the vaccine properly. And so I invite people, if your chance comes up, please take the vaccine. And for now, we have Pfizer and we have Moderna. And the hope is that in the next week and a half, Johnson & Johnson will get the emergency approval. And if that's the case, Johnson & Johnson already says that they can produce millions and millions of vaccines. And the difference between Johnson & Johnson, Moderna, and Pfizer is that it's going to be one dose instead of two. So you take it and that's it. You don't have to go back to get the second one like we are going to have to do. And they said that they feel comfortable with saying that the effects of the vaccine, like the benefits of the vaccine, will last a year, when with Moderna and Pfizer, we may have to get another follow-up in about 6 to 8 months. Then the research is still being done on that. But again, I invite the community, again, we as Latinos, Latinas who have the privilege to have access to the mics, to have access to, try and influence the community, we need to say, this is my experience. And in my situation, I invite anybody who has the opportunity to take the vaccine, please take it. Don't waste the opportunity, because it's going to take a long time before the opportunity comes around.
Yes, and we've administered a total of about 36,000 vaccines here locally, and that includes Kaiser, Sutter, St. Joseph, and the county. CVS and Walgreens is also doing vaccines, but we don't have their numbers yet on the CVS and Walgreens vaccines, but we hope to have those numbers soon. But we are working, like I said, through the phases. Hopefully next 2 weeks we'll get to essential workers, teachers, food and agriculture workers, and one of the main things that we ask the community is patience right now. Patience, because I know that a lot of people want the vaccine, but there's a supply and demand still until we get, and then, like I said, with the new administration, we'll be getting a lot more vaccines coming in and setting up more sites and more people to administer the vaccine. So we'll have ample opportunities later. And right now, we're a little bit limited, but we're moving through the different phases and tiers as much as we can through all of our partnerships that we have.
Definitely. And so it's important that the community knows the vaccine is going to arrive. Again, we have Pfizer and Moderna. The federal government just ordered another 200 million. So now they have ordered 600 million vaccines just from those two companies. And once Johnson & Johnson's is available, I'm sure we already ordered another 100 million or so. So there's going to be a moment where they're just going to be available. And then the process is what because I'm privileged also to attend these meetings with, with the county in regards to how quickly and how they're establishing all of these locations. The president is saying that he may end up sending, whether it is the National Guard or somebody else, to come over and assist with giving out the vaccine, not just the security part of it, but the actual vaccine itself. So, if the county is setting up the locations, and I think in the fairgrounds, your services will be able to reach something like 2,000 people a day at some point, something along those lines. I'm sure the number is off, but it's definitely not hundreds, it's thousands. And so if that's the case, by the time that one goes into effect, again, things are going to be much, much faster. The same thing with the one at Santa Rosa Junior College, Petaluma campus, that will be able to serve hundreds of people every day. And then the Huerta gym is going to offer hundreds of spaces. And so that's going to make it a lot easier. And yeah, one of the things we're just waiting is for the production to increase so that the delivery will be made available to our community. So I'm really excited to see what's, to hear and learn from you about the fact that the county is finally, setting up all these spaces. And the other thing that you keep saying is testing. Let's not just focus on the vaccine, but let's talk about testing.
Yes, and the testing is continuing. It seems like we've shifted to the vaccines, but the testing is still very important to identify those cases and help people to be able to isolate and take care of themselves and their families. So there's still testing going out throughout the community through the county and through our partners. So for example, every Monday at Roseland Library, we have testing. Every Tuesday in Rincon Valley, every Thursday in Cottingtown. So we have every day of the week, there's testing everywhere. And people can go to our website at socoemergency.org to find those sites, or they can also call the number 565-4667, and they can direct them to where they can go for testing. Some they can go to directly, some they do have to sign up through online, but it's really important to continue with the testing, encourage other people to get tested as well.
Definitely. And again, as I've always say, if you just found out that your colleague at work got sick and just reported to the boss, that, again, they're positive for COVID and you were close to them, right? Interacting with them maybe in the last couple of days and you didn't know, what I personally would do is I would look up that information at socoemergency.org, find out if there's a pop-up location for today, and just show up and present your case and say, look, I was just made aware. I don't want to go home right now and, possibly get my family sick. Can you do the test now? I need to isolate immediately. And then in 3 days or 2 days, whatever it is, you'll know the results. And if you are in a small apartment and isolation is difficult, then the county has a place. I know again that one of my students and family member ended up going to Hillsburg, and they stayed there for 2 weeks. Yesterday they came out; they're fine. But yes, as a result of that, they help, they secure the rest of the family from again getting sick, and that's exactly the perfect system. They went, they got tested, they came out positive. They went, they were in a safe space, and as a result of that, they were able to be healthy and safe.
Yes, and we provide a lot of this assistance, regardless of anyone's, immigration status or what, who they are. We provide this alternative care sites, that's the ACS that you're talking about, and resources will feed them, will, help to take care of their needs while they're there. And so we do everything we can to protect the community. And we have resources available, and we want people to know that we are here to provide whatever we can.
Definitely. And with that, unless you have anything else, I know you have a meeting coming up, and I know I have another meeting coming up, another interview. So I want to be respectful of your time. So I'm not sure if you have anything else, and if not, I will talk to you next week.
So mainly just be patient and continue protecting yourself by following all the protocols, social distance, using your mask. Very important, even after you get vaccinated. It takes some time, for it to take effect and stuff.
Thank you. And again, I want to thank you for being with me, and I look forward to our next conversation.
Thank you, Rafael.
Take care.